A lot of people, they'll say, is this a full facelift? And the answer is yes. One thing that is not necessarily included with a facelift is the uppermost face, the brow, and there's a separate procedure, the brow lift. But we also can combine even that with a facelift. And we just recently, in fact, did a facelift, a brow lift, and the CO2 laser resurfacing all in the same patient on the same day. So that, a lot of times the forehead is a little bit of a separate area because some people wear bangs that cover their forehead, and they'll say, well, I'm not worried about the wrinkles in my forehead. But just like the rest of the face, the lower face and the neck, you can very often, in fact, it's almost universal, you will see sagging of the eyebrows, and the eyebrows are the most visible structure, but in that area. But what's happening is just like in the rest of the face, gravity is a constant force that is pushing downward.
And so I guess this is a good for us to talk about what a full facelift can and can't do. So one of the really great things about facelift is jawline definition. So restoring a really good angle to the jawline. It's really phenomenal at doing that.
Yeah, and even in visibility of the jawline, because when there's a lot of sagging, the jowl especially will actually visibly be seen to go below the jawline, and the jowl is a very obvious part of the lower face where people often will notice sagging, and there's even a term for it, jowliness. And part of that is the prominence of the jowl, which it is an area that has a distinct fat pad. So reducing some of that fat volume, we do that with liposuction, and that will help the jowl. But the most important thing is the lift, to actually lift that saggy jowl above the jawline.
Yeah, so we help the jawline, and we also are lifting the jowl and reducing it sometimes with liposuction. But if we have to do the liposuction, that's included in the facelift. It's not quoted as a separate procedure. It's just depending on whether or not we think the patient would benefit from a slight reduction of that jowl.
And then very important is the neck. It can be a mistake to address, just the face and not think about the neck, because the neck is oftentimes, as prominent as the face when it comes to sagging, especially. And people can wear turtlenecks in the winter, but that's just a seasonal, opportunity to cover the neck. So what we see are, especially toward the middle of the neck, going up and down, are these vertical neck bands, and that's actually the edge of a muscle in the neck, and it stretches out because of gravity. So when we do a lift on the layer of fascia, so it's actually the same layer as that muscle tissue, and that's why it will smooth. It will have a very significant effect on tightening the neck. It's not just the skin, it's also that underlying fascia or muscle layer.
There also tends to be a little bit of an improvement for the nasolabial folds and the marionette lines. Certainly this mid facial area isn't typically what has the biggest impact. The biggest impact is going to be on the jowls, and it's going to be on the jawline and around the eyes. The mid face has a modest improvement with facelift as well, but it's certainly not something that is the main target of trying to do the facelift.
So we talk mainly about sagging, and a lot of times, people think, oh, I just have sagging skin, and that's what I need to have tightened. but it's actually more than that. So the next layer below the skin, in most areas, there is some fat, subcutaneous fat, and then right below that is the fascia. And the term SMAS, which stands for superficial musculoaponeurotic system, is a sheet of fascia, which is a type of connective tissue, and that covers most of the face and the neck. And the advantage of the fascia, it's a very tough layer. So when we do tightening and lifting, we can actually put significant amount of lift on that layer. And the concept of deep plane refers to loosening the attachments where that fascia, that SMAS layer, is actually attached to deeper layers. Like one of the most important is the cheekbone area, where the SMAS fascia is actually attached to the cheekbone. And if we loosen that particular attachment, we will get a much more significant lift. And we'll find the same kind of thing in the side of the neck area, where the SMAS layer there is also attached to deeper structures. So one key element to get a very strong neck lift is to loosen that attachment. So that's what we mean by deep plane, because majority of facelifts actually do not address that that particular issue, the attachment of the SMAS fascia. They simply tighten the fascia directly. If we loosen those strong attachments, when we lift or tighten, we will actually get physically a greater lift. And then the good news is that that fascia will then heal, will re-adhere in the improved position, which is in the lifted position. And it will hold, for years to come. So that's really the main reason that we see long-lasting results with this type of deep plane facelift.
Interesting thing about it is that we're using dissolving sutures. So the sutures dissolve after several months, and the tissue is still elevated in that deeper plane. So you don't need a permanent suture that's kind of always in there. It's just your own natural tissue that has been moved higher up for that facelift.
And it's your own healing that actually gives you that long-lasting result. So,
but in terms of thinking about all of the things that the facelift can do, there are also limitations. So a facelift does not improve skin texture, for instance. So if there's a lot of sun damage and a lot of very deep wrinkles from the sun, facelift does not really address that. That's left for CO2 laser resurfacing. And again, there are different ways and different levels of CO2 laser resurfacing, but a lot of our patients at the same time of facelift, immediately after facelift, since the face is already entirely numb, we're able to combine the CO2 resurfacing so that it's just one recovery period where you are recovering from the facelift and also recovering from the CO2 resurfacing, and both are about 1 week of downtime. So it's great. You don't have to do 2 weeks of downtime separated by however much time. You can just have one recovery for both.
And then there's another element that is not thought of quite as much, and that is the volume in the face. So one of the major changes with aging is the loss of volume. So especially around the mid part of the cheek, people would get a sunken in look, and this can actually be brought on especially by weight loss. So people that are on GLP-1 medications like Ozempic, who lose a lot of weight, they will frequently notice that their faces look a lot different, and a lot of that is the loss of volume. And when we do a facelift, especially a deep plane facelift, the volume, in some places there's too much of it, in other places there's not enough of it. But the lifting actually will reposition a lot of the volume and actually improve it. So one thing we see is a lot of improvement under the eye area. So this front part of the face is improved just because of the lifting of the fascia, which everything is sort of attached, like the skin is attached to the fascia. The subcutaneous fat layer is also attached, so it will get lifted. So the issue of volume is improved by the surgery. And then, we can go even beyond that and use filling substances, which are adding more volume, in specific areas. One in particular is using fat from the very same patient. So people are always concerned about how long a filler will last, and one of the longest lasting is autologous fat, which means fat, from the very same patient. So sometimes we'll do that, with a facelift, we'll add the fat from that same patient. Also can be done as a separate procedure. A lot of times, in fact, I will kind of do the facelift just to see how much improvement we also get in volume. And if there's not too much of an issue, that is all that is needed. We don't have to add additional volume with a filler or with fat tissue.